Thanks for joining us today with another video on how to take care of some of your back problems at home. Today I'm going to just show you a couple things you can do when you have back trouble at home and you can't get to see the chiropractor, you can't go out, or you just want to do some, get yourself some relief at home with something after a hard day at work. So the first thing is, without getting real technical, I'm just going to show you what someone can do for you and maybe something you can do for yourself. So that you can get through a tough day at work or something like that. So the first thing is this. In this case, this patient had a car accident and the muscles on this side of his back and his low back and into his butt. I'm not going to be real technical here, I'm just going to try to make the point. These muscles here and these muscles here are really tight from being in spasm because the bone got knocked out of place and the ligaments are weak. But what you can do at home is this. If you could have somebody, if you could have somebody do this for you. You can get in this area right in here and dig it out with your thumbs. And it's the area right below what we call the crest of the ilium. So as if you go right to your hip bone right here, your pelvic bone, and you drop down just a little bit, here's your femur bone, here's your pelvic bone, and right in there there's a spot where you can just get in there and work like this for just a few minutes at a time with your thumb. And believe me, if there's a tight muscle in there, you'll find it and they'll know it. And they'll let you know when it's sore. So you can work that for a few minutes like this, and then you can go to the other side and take this part of your hands, the top of the pelvic bone, drop down a little bit, and you'll find the sore spot, believe me. So you just work on that a few minutes like that, and you can work it until you can either work it out or until the person's had enough of it, because sometimes the more you do it, the good news is it loosens it up, but the bad news is it just it hurts a little bit. So you go to their tolerance. You're not trying to hurt anything. You're just going to their tolerance. And then usually when there's a problem in the pelvis, there's also a problem in what's called the iliotibial band. It's iliotibial band syndrome. Very popular term in sports, and when I was with the athletes at the Olympic team, we had this all the time. So what you can do for that, usually there's a connection between the iliotibial band and the pelvis as well as the feet. So I'm just going to work my way down here. I've already shown you these muscles in here that can be worked like this. And then you can come down here. There's a bone here. This is the femur bone. Another term is trochanteric bursitis. That's another tendinitis term. It's a very famous term. But the muscle, the iliotibial band goes here. So what you can do is you can work your way down and you're just grabbing it like you're kneading bread. Just like this. And you can get more particular with this part of your hand and just kind of dig on it, stretch it, go across it like this, and you can do that, and that goes down into the knee because it will affect the knee a lot of times. And then you can just literally work down the leg like this and take the whole leg just like it's a loaf of bread and knead it just like this, and then you come back up to here. And then there's another thing. Julio, just lay on your back for a minute now. So now I'm going to show you another way to get at this iliotibial band, for this iliotibial band syndrome. Now, you can take something like this, or even like this, and put it together. Or better still, have a roller pin. If you have a roller pin at home, that's good too. And what you do is you get on the side, and you can go like this, just like this. You go to the patient's, you go to your friend, family member's tolerance. You're not trying to hurt them. But I can guarantee you that's going to be a sore area. So what you do is you can press like this, you can press like this, and you go to their tolerance. You'll know that it's sore or too much when they start flinching. But you can go like this, and you can go on the side, just like this. Just like this. You can go down, and you can pull back. You can go down, you can pull back. You can also do it with the quads, the quadriceps, which is this muscle here when there's problems in the knee or in the back, like that. And that helps to loosen up the tendons, the muscles. It does all kinds of technical things, but what we're basically trying to do is show you where the sore spot is and work out the sore spot, relieving a lot of pressure on these joints and allowing the bones to settle back properly into the low back. And then so you do this. And you can just finish by using pressure points like this. It's really quite simple. This is something you can get at Lowe's, Home Depot. This is PVC pipe. Sometimes people will just use this, like this. It's very handy. Somebody can do it. You can do it to somebody, or somebody can do it to themselves. So I wanted to show you those things you can do, and then I'm going to show you one other thing. Let's have you lay on your stomach, please. Now this is how you finish up the exercise. Come up on your hands and knees and put your butt. Sit on your heels, just like that. Your hands out like this. just like that. I don't know what it's called in yoga, but it's a yoga posture. But it's very good. You can see how this patient can come down so far. Some people can go further. It depends on how tight it is in here. So this is a good way to finish, and it's a tremendous way to relax a lot of the muscles in the back, the pelvis, and the legs, and help relieve a lot of chronic problems of the back, iliotibial band syndrome, chronic patellar tendonitis, quadriceps, hamstrings, things like that. So thanks for listening, and we'll see you on the next tape.